Hey, future nurses. It is Dr. Nurse Tutor here. I wanted to come and have a little conversation with my nursing students. I recently had a conversation with a nursing student of mine who is currently in Medsurg Adult Health 2. She had expressed some concerns about not being successful in the course and not understanding why she was not successful. I did really well in pathophysiology. I did really well in physical assessment. I did really well in fundamentals. I passed exam 1 and exam 2 in adult health 2, but I barely passed. And I'm not understanding because I was such a great student in the previous quarters. I'm not understanding why I'm not getting it. Now, here's the thing. What I want you guys to understand, because I've taught all those classes. I've taught pathophysiology. I currently teach pathophysiology. I've taught physical assessment. I've taught fundamentals. I haven't taught specialties because that's just not my thing. I've taught, and I currently teach adult health 1, 2, and 3. Here's what I'm noticing from you guys when you get to adult health from me and why you're not successful. You guys still remain surface level nursing students. What do I mean by that? When you are in patho and physical assessment and fundamentals, in pathophysiology, I teach you what the disease process is. So those questions that you're answering are all knowledge-based questions. I give you a question about a disease process and you tell me what it is. I ask you or present you with manifestations and you tell me what disease process that is. When you get into physical assessment, you're doing a head-to-toe assessment on a patient. You're identifying things that are wrong based off of manifestations. When you get into fundamentals, you learn how to do all the things. You're placing Foleys. You're using crutches. You're doing wound care. You're dressing wounds. I even teach pharmacology. I teach pharmacology 1 and 2 in the BSN program. You're understanding the medications. What is the mechanism of action? Right? What is the desirable effects? What are the side effects? What are the adverse effects? What are the complications? Do these medications cause toxicity? And what are they? Those are all knowledge-based questions. When you get to me in adult health, it is a completely different ball game. You have to take all of the information that you have learned from your previous courses. I present you with a case, with a patient who has something wrong. If you're lucky, the question will tell you what the disease is that the patient came in with. If you're not lucky, it's just going to tell you what that patient came in with, what the subjective information they gave you, the objective information that you have collected. And based off of that information, you got to tell me not only what's wrong with that patient in the question, but also how you're going to take care of this patient. And if you're lucky, they're going to want you to prioritize. Tell me what the priority is. Or you may get hit with the select all that apply. Or you may get hit with an NGN style question where they give you a case study and you have to do a drop down or a bow tie or a drag and drop. The reason why you guys are not successful in adult health is because you're still surface level. For instance, there are very popular questions that we like to ask you when you're taking an adult health exam. What are these kind of questions? Priority. Priority is huge. Majority of your exam is going to be priority. They're going to give you a case. The patient came in with something. We want you to prioritize what your plan of care or your interventions are going to be for this patient. What does that mean? That means A, B, C, D, and maybe even E are all going to be correct. You have to tell me what you're going to do first. A lot of my students have all the right answers, and then they choose a correct answer on that exam, and it's wrong. Why is it wrong? Because you didn't prioritize. If you don't prioritize, you can't get it right. Select all that apply. You got to tell me all of the things. Now you know all the things. Now tell me all of the things that you're going to do. That's not a scary question because I'm going to tell you how to break that down. All right. When you get a bow tie or you get a drag drop, you're going to get report. That case study is literally report. You got to read the report. They're going to tell you what the patient came in with. They're going to tell you what the patient's vital signs are. They're going to tell you what the labs are. Now you got to tell me what you're going to do. All right. How do I study for this? How do I stop being a surface level student when I get to applying? Adult health is all about applying yourself. From what you learned about these disease processes and how they can kill somebody, how do I apply myself to save this patient's life? Now, Because when we start teaching you, the first thing I'm going to teach you is this is the disease process, this is the pathophysiology. When you go to write your notes, disease process, or should be on the top of your notes, the disease process. The first thing that you should write next to that disease is the pathophysiology. Give me the patho. What is this disease? The next thing you need to write are the manifestations. What are the signs and symptoms this patient's going to come in with, right? If I don't treat these manifestations, there are going to be complications. What are the complications that can arise with this patient? When you go from complications, put the medications down. What medicines does this patient need to be on? Next, I need to know my desirable outcomes, what I want to see happen. As soon as you write your manifestations, next to every single manifestation should be an intervention. If you have a manifestation, there should be an intervention. Because if you don't have something to combat that manifestation, it will turn into a complication. All right? So, for instance, you have a question and I want manifestations from you. Rule of thumb, stop putting fatigue and malaise as a manifestation. Fatigue and malaise is way too vague, and you're never going to see that on an exam. Because fatigue and malaise is a systemic manifestation. If someone comes in and tells you that they're feeling fatigue or they're feeling malaise, you're never going to know what to do because you need more information. So that is not a manifestation that you should be using. You should be telling me, for instance, my patient has anemia. I don't know that when they come in, right? So if I ask you, what are the manifestations that will pinpoint, that will let you know that this patient has anemia? You should be telling me dry, coarse, brittle nails and hair. You should be telling me something about the mucous membranes being pale. You should be telling me pica. They're coming in, they're eating ice, they're chewing pencils. The patient tells you that they're eating baking soda. Things like that's going to automatically make you think iron deficiency anemia. If this patient has pernicious anemia and it's B12, low B12 deficiency, they're going to have a red, beefy tongue. That's what I mean by specific manifestations. Next to every manifestation, there should be an intervention. Because the only way you're going to know how to take care of this patient is if you provide an intervention to the manifestation. Now, how do I prioritize this? Priority is always ABCs. It's always ABCs. Airway, breathing, circulation. Is there an airway, breathing, or circulation answer in this question? Because if it is, it will always trump everything else. If it's a safety question, how do I keep this patient from getting harmed? If it's an education question, anytime it's an education question, that means the patient is stable. If your patient is not stable, you should not be educating them on anything. If the patient is just being admitted, you shouldn't be educating them on anything. Education happens when the patient is stable. Airway, breathing, circulation will always be your priority. Now let's talk about questions. If you get a question, I always tell my students, the answer will always be to assess. The answer if there is an assessment in that answer choice, it would always be to assess, but you got to know when to choose it. If you're looking at a question and the question tells you that the patient comes in presenting with something and there is no assessment in that question, there is an assessment in the answer choice. You have to know what assessment answers look like. Auscultate. Check the vital signs, pulses and perfusion, neurovascular checks. Those are all assessment answers. If there isn't an assessment in the question, look for an assessment in the answer. The assessment should coincide with the problem. If that patient has chest pain and the assessment answer says to listen to the bowel sounds, that does not coincide. There should be something related to chest pain, and 9 times out of 10, because I see it all the time, the assessment answer will coincide. You cannot do anything or provide any intervention if you don't assess. If the assessment is in the question, vital signs, auscultation, I check a level of consciousness, there's already an assessment in the question, which means you can't choose an assessment answer. You have to choose an intervention. This is when you prioritize. Select all that applies, write all your interventions down, and then go from there when you're answering the question. Now, I'm losing time. I'm going to come back with a part 2 on this, so stay tuned. I'm going to help you guys answer and figure out how to answer these exam questions in adult health and med surg. All right, it's Dr. George. I'll be back.